Imagine this. You put your shoes on in the morning and they fit perfectly. Then by 3 in the afternoon, you can feel your socks cutting into your skin. Then by the time dinner is ready, you look down and your ankles have disappeared. Your feet look like bread dough. Someone pressed a thumb into when you actually press a finger into that puffiness, the dent stays there for several seconds before it slowly fills back in. Most seniors who experience this have been told the same thing. Drink less water, eat less salt, put your feet up, and if it keeps happening, take a water pill. And so they do. The swelling improves for a day or two, then it is back. Then they take another water pill. And the cycle repeats for months, sometimes years, while the actual cause, the thing quietly driving all that fluid into your legs every single day, goes completely unaddressed. What I want to share with you today is actually what usually causes that, why it gets worse specifically as the day goes on, and why the standard medical response to swollen legs in seniors so frequently misses the most important part of the picture entirely. Before we get into the cause, let us talk about what is actually happening when fluid builds up in your legs by evening, because once you understand the mechanism, everything else falls into place. Your body has two kinds of blood vessels working all the time. Arteries carry fresh oxygenated blood from your heart out to every part of your body, including your legs. Veins carry the used blood back from your legs upward against gravity to your heart, where it gets replenished with oxygen and sent out again. Arteries have thick muscular walls that push blood forward with each heartbeat. Veins do not work that way. Veins are thinner, more passive, and they rely on a system of tiny one-way valves spaced throughout their length to keep blood moving in the right direction. When the calf muscles in your legs contract as you walk or move, they squeeze the veins and push blood upward. Those valves slam shut behind each push to prevent the blood from falling back down. When everything is working correctly, the system is elegant and efficient. When the valves start to fail, which happens increasingly with age, it is not. When those one-way valves in your leg veins weaken and stop sealing properly, blood begins to drift backward between heartbeats. It pools in the lower part of your legs, out in your ankles, in your feet. The pressure inside those veins slowly builds up throughout the day as more and more blood settles lower than it should. That pressure starts forcing fluid from inside the blood vessels out into the surrounding tissue. Not blood cells, just the fluid portion of blood, which is essentially a clear liquid called plasma. That fluid seeps into the spaces between your cells, settles into your ankles and feet because gravity pulls it downward, and that is the swelling you see and feel by evening. The medical term for this condition is chronic venous insufficiency, meaning the veins in the legs are chronically insufficient at doing their job. And according to research published in peer-reviewed literature, this is the cause of leg swelling in roughly 70% of older adults who present to a doctor with this complaint. 70%. It is the single most common cause of evening leg edema in seniors, and yet it is routinely dismissed, under-examined, or treated as a secondary concern while other explanations get chased first. The reason it gets dramatically worse as the day goes on is straightforward once you understand the mechanics. Every hour you spend upright, whether sitting, standing, or even walking with compromised valves, gravity is working against you. Fluid that is leaking out of your veins collects progressively. If you sat still for the entire morning, some fluid has gathered by noon. By mid-afternoon, several hours more of gravity-assisted fluid drift have added to that collection. By evening, you have 6, 8, and 10 hours of accumulated fluid sitting in your tissue, which is why your legs that looked fine at breakfast look unrecognizable by dinner. This is also why the swelling typically improves overnight when you lie down. Gravity is no longer pulling fluid toward your feet. The lymphatic system, your body's drainage network, can slowly reabsorb and process some of the excess fluid while you sleep horizontally. You wake up with legs that look almost normal, and then the whole process starts over again. Many people assume this morning to evening pattern means nothing is seriously wrong because the swelling always goes away by morning. What it actually means is that the underlying problem is consistent and repeatable, which is the exact definition of a chronic condition that needs evaluation. If this pattern sounds familiar, shoes fine in the morning, legs unrecognizable by evening, the people watching this who experience that deserve to know they are not alone and that there is a reason it is happening. The comments are full of seniors who thought this was simply aging. It is not simply aging. There is a cause, and causes can be addressed. Now here is the part that most standard doctor visits miss, and it is something that frustrates vascular surgeons and cardiologists regularly. When an older adult comes in with swollen legs, the most common first response is a diuretic, a water pill. A diuretic tells the kidneys to pull more sodium and water out of the blood and excrete it as urine, which reduces overall fluid volume in the body and can temporarily reduce the swelling. The problem is that when the swelling is caused by venous insufficiency, a diuretic is not treating the problem. It is treating the symptom. The valves are still failing, blood is still pooling, fluid is still leaking into the tissue. The diuretic just reduces how much fluid is available to leak. The moment you stop the diuretic or the body adapts to it, the swelling returns. Meanwhile, long-term diuretic use in older adults carries real risks, including electrolyte imbalances, low potassium, dehydration, and kidney stress, none of which address the failing valves that started the whole problem. The research supports this concern directly. A review published in the medical literature on bilateral leg edema in the elderly found that in 60% of cases, the cause was not a single factor, but multiple overlapping factors at the same time. Have venous insufficiency combined with another condition. Venous insufficiency plus a medication side effect. Two separate drug-related causes running simultaneously. And here's the second major thing most doctors miss: the medications themselves. This is one of the most under-recognized causes of leg swelling in seniors, and it may apply to you right now. One of the most widely prescribed blood pressure medications in the United States is amlodipine, sold under the brand name Norvasc. It belongs to a class of drugs called calcium channel blockers, specifically the dihydropyridine type, and it is on the World Health Organization's list of essential medicines. It is also one of the most common drug causes of leg swelling in older adults. Research published in PMC analyzing data from over 56,000 patients across 71 studies found that people taking amlodipine had 3.34 times the risk of developing peripheral edema, that is the medical term for fluid in the legs and ankles, compared to people taking a placebo. And the effect is dose-dependent. At a 5 milligram dose, around 5% of patients develop edema. At the 10 milligram dose, that figure rises to about 25%. And for those on even higher doses, it can exceed 75%. The mechanism is specific and has been well studied. Amlodipine dilates the small arterioles, the tiny blood vessels that feed your tissues, but it does not dilate the corresponding small veins downstream to the same degree. This creates a mismatch. Blood rushes into the tissue faster than it can drain out, and pressure builds up in the tissue, forcing fluid to seep out. Importantly, giving a diuretic on top of amlodipine does not reliably fix the problem because the edema from amlodipine is not caused by excess fluid in the body overall. It is caused by a local pressure imbalance in the leg vessels. Research has shown that diuretics have minimal effect on calcium channel blocker-induced edema for exactly this reason. Gabapentin, sold as Neurontin, is another medication that millions of seniors take for nerve pain, restless leg syndrome, or as a sleep aid, and it also causes peripheral edema through a similar vascular mechanism. Research on gabapentin found that 7.5% of people taking doses at or above 1,800 milligrams per day reported fluid retention and leg swelling. Its close relative pregabalin, sold as Lyrica, carries the same risk. NSAIDs, that is nonsteroidal anti-inflammatory drugs, the category that includes ibuprofen and naproxen, cause fluid retention by interfering with kidney function and sodium excretion, which expands fluid volume throughout the body. Corticosteroids like prednisone cause fluid retention through a similar renal mechanism. Certain diabetes medications, specifically the thiazolidine class, including pioglitazone, very commonly cause peripheral edema. And some beta blockers used for blood pressure and heart conditions also contribute to leg swelling. The reason this matters so much is the pattern it creates. An older adult is started on amlodipine for high blood pressure. After a few months, their ankles begin to swell. They go back to their doctor, who notes the swelling and writes a prescription for a diuretic, so not connecting it to the amlodipine. The swelling partially improves. The following year, they develop nerve discomfort and are started on gabapentin. Now they have two drugs, both contributing to leg edema. The diuretic is adjusted upward. The swelling persists. They start avoiding evening walks because their legs are uncomfortable, which reduces calf muscle activity, which worsens venous return, which adds another layer of fluid buildup on top of the drug effects. Nobody has stepped back to look at the full picture. The failing valves, the medication effects, and the inactivity all compounding each other simultaneously. This is the silent fluid buildup the title of this video is referring to. Not one dramatic cause, but multiple quiet contributors building on each other unobserved. If you are taking a blood pressure medication and your legs have started swelling since you began that medication, write down the name of the medication and the approximate time frame and bring it specifically to your doctor's attention. Tell them, the swelling started after I began this medication. Ask directly whether the medication could be contributing. Ask whether there is an alternative blood pressure medication that carries a lower risk of leg edema. For people on amlodipine specifically, research has shown that adding an ACE inhibitor or an angiotensin receptor blocker to the regimen, rather than increasing the diuretic dose, can significantly reduce the leg edema while maintaining blood pressure control. There is often a more targeted solution available, but it requires someone asking the right question first. There is a third cause that belongs in this conversation, and it has been directly measured in seniors through a published study in the journal Neurology and Urodynamics. In a study of 52 men over the age of 60, researchers measured daily salt intake, leg fluid content at 5 p.m., and leg fluid content the following morning at 6 a.m. The finding was clear and direct. Daily salt intake positively correlated with the amount of fluid in the legs, specifically by late afternoon. Not with morning measurements, not with midday measurements, with the end-of-day measurements after gravity had been working for hours. When you consume sodium, the mineral in salt, your blood chemistry changes in a predictable way. Sodium attracts water. The body retains water in the bloodstream to dilute the excess sodium and maintain the proper concentration. That extra fluid volume raises pressure inside the blood vessels throughout the body. In the legs, where the veins are already fighting an uphill battle against gravity, that additional pressure becomes the tipping point that pushes more fluid out of the blood vessels and into the surrounding tissue. The CDC estimates that over 70% of the sodium consumed by Americans comes from packaged and restaurant foods, not from the salt shaker at the table. This means the person who never adds salt to their food is still consuming substantial sodium through the soups, sauces, deli meats, bread, crackers, frozen dinners, and restaurant meals that make up the majority of the modern senior diet. The swelling you see at the end of the day is therefore often the sum of several forces: veins with weakened valves that cannot fully fight gravity, a medication that is dilating the feeding arteries faster than the draining veins can respond, and a sodium intake that has raised fluid pressure throughout the circulatory system, so that more fluid leaks out at every imperfect valve point. Each of these causes is real, each is measurable, and each is at least partially addressable. But none of them get addressed when the only response to swollen legs is a higher dose diuretic and an instruction to put your feet up. Now let us talk about the warning signs that separate ordinary evening leg swelling from something that requires urgent attention, because not all swelling is the same and your safety matters more than any other part of this conversation. The swelling from chronic venous insufficiency typically affects both legs, usually develops over months or years rather than days. Gets worse as the day goes on and improves with elevation overnight. The skin over the swollen area may feel tight or look shiny. When you press a finger firmly into the swollen area for about 5 seconds and then remove it, the indentation holds its shape and slowly refills. Doctors call this pitting edema. This is the most common pattern in venous insufficiency-related swelling and medication-related swelling. The symptoms that need same-day medical evaluation are different in character. Swelling in only one leg, especially if accompanied by warmth, redness, or aching pain in the calf, can indicate a deep vein thrombosis, which is a blood clot in the deep vein of the leg. This is a genuine emergency because that clot can travel to the lungs and cause a pulmonary embolism. Swelling that comes on suddenly over hours rather than gradually building over a day, especially if it accompanies shortness of breath, chest tightness, or difficulty breathing while lying flat at night, needs to be evaluated the same day for possible heart failure. Swelling that does not reduce at all overnight after lying flat, meaning your legs look just as swollen first thing in the morning as they did the night before, is worth reporting to a doctor promptly because it suggests the fluid volume or the pressure driving it has moved beyond what lying flat can correct. And swelling that is accompanied by skin changes: reddish-brown discoloration near the ankles, skin that feels hard or leathery, open sores that will not heal, or patches of skin that look inflamed and ooze fluid, indicates that the venous insufficiency has progressed to a more advanced stage called venous stasis dermatitis, which needs specific treatment to prevent ulcers and infection. Skin discoloration above the ankles that looks like a brownish stain, even without other symptoms, is a sign from the body that blood has been pooling long enough to start leaking red blood cells through the vessel walls. Those cells break down in the tissue, releasing pigment that permanently stains the skin. That color change is irreversible, and it is a signal that the condition has been present long enough to cause tissue-level damage. For the majority of seniors whose swelling follows the predictable morning to evening pattern without those warning signs, there are specific, practical changes that directly address the underlying causes rather than just managing the symptom. The most evidence-supported first step for venous insufficiency-related swelling is compression. Graduated compression stockings or socks apply more pressure at the ankle than at the calf, which mimics the function of the failing venous valves by mechanically supporting the veins against the backward drift of blood. The compression rating that most vascular surgeons recommend for typical evening swelling is between 20 and 30 millimeters of mercury. Below that range, the effect is minimal. You can find compression socks at most pharmacies, and they do not require a prescription at this strength. The critical thing is putting them on in the morning before you get out of bed, before gravity has had the chance to begin pooling fluid. If you wait until afternoon when your legs are already swollen to put compression socks on, they are far less effective. The sock needs to prevent the fluid from accumulating, not fight it after it has already pooled. Walking, even in short intervals, is one of the most powerful tools available for venous insufficiency. Every time your calf muscles contract during a walk, they act as the muscular pump that your weakened valves cannot fully provide. A 10-minute walk 3 times a day provides significantly more benefit to venous return than 30 minutes of sitting followed by one long walk. The rhythmic contraction and relaxation of the calf muscle is what drives blood upward, and brief frequent movement keeps that pump active. For people with limited mobility, even seated calf raises, pressing the heels up and down while seated, or tracing circles with the feet, activate the same calf muscle pump and can meaningfully reduce fluid accumulation by the end of the day. Leg elevation above the level of the heart for 20 to 30 minutes during the day works with gravity instead of against it, helping the fluid that has already accumulated to drain back into the circulatory system. The key detail is that the legs need to be genuinely above heart level, meaning you need to lie down and elevate your legs on pillows, not simply sit in a recliner with a slight incline. Sitting in a recliner does move your feet somewhat upward, but rarely gets them above heart level, and the pooled fluid needs that gravitational advantage to drain efficiently. On the dietary side, reducing hidden sodium is a practical and high-impact change. The specific targets are processed meats like cold cuts, sausages, and bacon, which carry enormous sodium loads. Canned soups are another major source. A standard can of condensed soup can contain over 1,700 milligrams of sodium, which is nearly the entire daily recommended intake in a single serving. Frozen meals, packaged sauces, restaurant takeout, and seasoned crackers are all significant sources. Switching from regular canned goods to low-sodium versions, cooking with herbs and spices instead of salt, and reading labels for sodium content are all changes that begin showing effects in the legs within a few days because sodium moves through the body quickly. What you deserve after years of being told to simply take a water pill and put your feet up is a proper evaluation. A duplex ultrasound of the leg veins, which uses sound waves to visualize blood flow and identify failing valves, takes about 30 minutes, requires no injection, and gives a vascular surgeon or cardiologist a clear picture of exactly where the venous insufficiency is occurring and how severe it is. Asking your doctor for this test by name is a reasonable and appropriate request for anyone who has had persistent evening leg swelling for more than a few months. Combine that with a medication review specifically asking whether any current medications are contributing to leg edema and a sodium count of your actual current diet versus the recommended limit of 2,300 milligrams per day, and you have the 3-part picture that most medical visits have never put together for you. Your body has been sending this signal every single evening, reliably and repeatedly, for months or years. The swelling disappearing overnight has perhaps made it feel like something you could keep managing around rather than resolving. But an evening symptom that returns every single day is not a nuisance. It is a consistent message from a system under strain asking to be properly heard. You have that right. Take this information to your next appointment, ask the specific questions, and give your legs the proper attention they have been earning every day. If something here answered a question you have had for a while, please share this video with someone else who needs it. And subscribe if you want to stay ahead of the health conversations that do not always make it into a standard 15-minute appointment. See you in the next one.